Do you have thyroid problem? Do you know what kind of thyroid problem do you have? Is it hypothyroidism or it is hyperthyroidism? If not sure, then stay tuned with me because we are going to discuss how do you conclude that what kind of thyroid problem do you have in today's video. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. On this particular channel of mine, I've got lot of videos on thyroid. And to my surprise, I came across so many comments of people and viewers writing that doctor, I'm taking so and so medicine. What thyroid I have? I'm taking this medicine on an empty stomach. What kind of thyroid problem do I have? And reading this kind of a comments really surprised me because on my channel I have covered almost every topics pertaining to thyroid. And when you have such a basic question, when people ask you and where they are not sure of their diagnosis, it really surprises and it already shocks me because how can you keep on taking a pill when you are not sure of your thyroid problem? Not only that, let's assume that you got some other health issue and you go to a doctor or maybe in an emergency situation, go to an emergency department, and when that doctor takes a history and you say, I have this kind of problem. Let's say you say, I have a hyperthyroid, and then you say, okay doctor, what medicine you take? You say, I'm taking levothyroxine. So it's completely opposite. This means two things. Either you are not sure of your thyroid condition and or you have no knowledge about it. And if that is so, it can be really dangerous situation. So it is very important for you to know your diagnosis, that what kind of thyroid problem do you have, because it is going to affect you somewhere or the other way. So in today's video, we are going to discuss how do you come to know what kind of thyroid problem do you have, and there are different ways which can help us to know. So let's learn about that today. So see, thyroid conditions are of many types, but the most common condition is two conditions. First, where your thyroid is working less, what we call it as a hypothyroidism, and the second, where your thyroid is functioning more, what we call it as a hyperthyroidism. So in today's video, we are going to stick to only these two conditions, whether you have hypothyroid or you have hyperthyroidism. So there are four different ways by which you can know about it. Let's learn the first way, and that's your body symptoms. Yes, your body is going to give you some or the other symptom and you must pay attention to those symptoms. But diagnosing the type of thyroid based on the symptoms will be applicable only in the initial stage of the thyroid problem. Because once you have a thyroid problem and you start treating that by taking a medication, your symptoms will disappear or they may even reduce in the intensity. So after consuming pills, it will not be a very correct method of diagnosing, but yes, in the initial stage when you have not taken thyroid medicine, by knowing the symptoms, you can come to a conclusion in a relatively nice way. So let's learn about the body symptoms. Another drawback with this symptom is that sometimes some of the symptoms overlap in both the condition, hypo and hyper. So that can also be confusing, but there are certain symptoms which are very specific to hypo and hyperthyroid conditions. So let's learn about the symptoms. So we'll start from head to toe, so easy for you to understand. So we'll start with the hypothyroidism. So when you have a hypothyroidism, a person usually has the symptoms like a hair fall. Okay, they find that their memory is very poor. They don't remember things. They forget things. They can't learn new things. These are the very common forgetfulness is there. Then these are the people who mentally feel very low, very depressed. Depression is very common with the hypothyroid. They have a very high need of a sleep, and irrespective of number of hours they sleep, they still want to sleep. And in fact, these are the people who are coined as a lazy people. In fact, they are not lazy. It's just that the body symptom is such that it's making them fall asleep more. Okay. Coming to our face area, so we'll talk about the eyebrows. Especially the outer 1/3 of the eyebrow is a hair loss, which is very specific to the hypothyroidism. So if you have a loss of the outer 1/3 eyebrow, it can be indication of the hypothyroid. Not only that, the face looks like a swollen, what we call it as a puffy face. Tongue at times is also red and swollen in such people. And if we talk about the skin is very dry. Okay, in spite of applying moisturizer again and again, they still feel that the skin is becoming very dry. Okay, so these are the certain symptoms which can appear on the face. Coming to our neck area, so where we have a thyroid gland, the thyroid gland can be enlarged, what we call it as a goiter. Coming to the chest area, in the chest area we've got our heart, and heart rate can be low. In fact, these are the heart rate. So when you wear any kind of a smartwatch, if your heart rate is continuously low, it can be an indication of a low functioning thyroid gland, and that we call it as a bradycardia. Not only that, these are the people who have a very sluggish metabolism, and that is the reason why whatever they eat does not get digested very fast, and that's the reason why they keep on gaining weight. Weight gain is very common with the hypothyroidism in spite of having a low appetite. Not only that, because their digestive system is very slow and sluggish, these are the people who have a very difficulty in passing motion, and a constipation is also very common. If you are a woman, then you might find that your periods are getting irregular and disturbed. You might find that you have a difficulty conceiving, and infertility can be a common problem as well. Not only that, these are the people who have a lot of joint pains, muscle aches and pains, fatigue, lethargy, weakness. All of this can happen if you have a hypothyroidism. Now let's move on to hyperthyroidism, where the condition is completely opposite. You have more thyroid hormone, more T3 and more T4, making you having a high metabolism, and that's the reason why everything which happens in hypothyroid will be completely opposite here. So let's start what happens in hyperthyroid again from head to toe. Coming to the head area, of course, hair fall is common. It's common in both the hypo and hyper condition. But here when we talk about the hyperthyroid condition, these are the people who have a very anxious kind of a behavior. They are very confused. They are worried all the time. Anxiety is very common among them. They are not suffering from depression. When we talk about the sleep, okay, their sleep is highly fragmented. What we call it is insomnia. They have difficulty in sleeping. They wake up early. These are the very classical with the hyperthyroid symptom. In fact, these are the people who wants to do everything at one time, and at the same time they are highly confused. Okay. Then if we talk about the face area, then the loss of the outer 1/3 eyebrow is not very prominent in hyperthyroid. It is more prominent in hypothyroid. If we talk about the appearance, then their eyes is a very typical appearance. They find that their eyes are as if it's going to pop out. So enlarged eyeballs, what we call it as a proptosis, is quite common. And because of that, these are the people who have a vision problem. They keep having irritation in their eyes and a dryness in the eyes. Though entire body is highly moist, but the eyes, they have a very typical dry eye problem. Okay, many times these are the people, when they are passing by, they catch unwanted attention of people because of their very typical eyeball appearances. Okay, if we talk about the face is a quite shrunken kind of a face. It's not like a puffy face what we see in hypothyroid. When we come to the neck area, goiter is present in both the condition, hypo as well as in the hyperthyroid condition. If we talk about the chest area, then we talk in the heart rate. Then heart rate of such people are very high. So again, on your smartwatch, if your heart rate is more than 90, most of the time this can be indication of a hypothyroidism, and that we call it as a tachycardia. And most of the time these are the people who can feel their own heart rate, they have palpitations. If we see their body, then their body is always in the state of a trembling. If they hold something, it falls easily. If you ask them to outstretch their hands start shaky. So such shakiness is common with the hyperthyroid people. Not only that, if you touch their skin, the skin feels cold, moist, as if they have, they've come out of a bath. And their skin, they have a lot of sweating. So these are the certain symptoms which are typical of the hyperthyroid people. Because the metabolism is fast, whatever they eat gets digested very quickly. And that's the reason why these are the people who feel hungry again and again. And in spite of eating more and more, they are not able to gain weight. In fact, they start losing weight because the metabolism is super duper fast. And because the metabolism is fast, their motions are also often fast. And these are the people who complain of a frequent toilet, frequent motion, sometimes even the loose motions. And if you are a woman, you might find that your periods are irregular, which is again common in both the condition. Infertility is also common in both the condition. So these are the symptoms based on which you can decide what kind of thyroid problem you have. But as I told you earlier, the symptom based diagnosis can happen only in the initial stage when the thyroid hormone is not corrected. Because once we give you the medication, the symptoms is going to subside. So that may not be a right way to come to a conclusion, but in the initial stage, yes, this does help. All right. Second way to come to a conclusion whether you are hypo or hyperthyroid is based on the blood test. In fact, these are more reliable. But again, in the initial stage, they are more reliable ones. So when we do a blood test, your doctor often asks you to do a testing called as a thyroid function test. This thyroid function test includes two kinds of a testing: TSH, T3 and T4 hormone. When you have a hypothyroid, your T3 and T4 hormone is going to be low, and because of that, your TSH hormone, which is actually a pituitary hormone, that's going to be elevated. So if you find that your TSH is 10, 20, 30, 40 or more, this means you have a hypothyroid state. And if you find that your T3 and T4 hormone is high, and because of that your TSH hormone is suppressed, let's say 0.001, 0.01, 0.008, if you have such suppressed TSH, this indicates that your body is in a hyperthyroid state. Okay. Another testing what we do is the antibody testing. These antibody testing are done mainly to come to a conclusion whether you have an autoimmune problem or not. And for that, again, three kind of antibodies are done. First is an anti-TPO antibody. Second is anti-thyroglobulin, that is a ATG antibody. And third one is a TSH receptor antibody, short form is TRAB. Now, all these three antibodies can be high if you have any kind of a autoimmune problem. Usually we've seen that people who have a hypothyroidism due to autoimmune condition like Hashimoto's disease have a higher levels of anti-TPO and anti-thyroglobulin levels. And the people who have a hyperthyroidism due to autoimmune condition Graves' disease have a high level of a TSH receptor antibodies. Usually TRAB antibodies are not elevated in Hashimoto's, but of course there are few cases where we do find that level also high, but mostly they don't have a high TRAB levels. Okay, so this is the second way of coming to a conclusion. But again, this can be applicable in the initial stage of the thyroid problem, because once we give you a medication based on your individual medical case, these reports are going to change. And so if you are taking a medicine and after a follow-up of few months, if this level remains, that means your thyroid is definitely not controlled properly and you need to change or your dosage of the medication or the medication altogether. So please speak with your doctor accordingly. So that's the second way you come to a conclusion. Third way coming to a conclusion, and which is again a relatively best method, is by what medication you are taking. Okay, so if you have a hypothyroidism, in this situation your thyroid hormone production is low, and because of that your doctor has prescribed you thyroid hormone replacement therapy. And thyroid hormone replacement therapy, when we talk about the hypothyroidism, is usually of levothyroxine or levothyroxine sodium or thyroxine or T3 hormone, and internationally medications like cytomel and armour thyroid or glandular extract, those kind of the medicine, or tyrosint. These are the medications if you are taking, that means you have a hypothyroidism. Okay. If you have hyperthyroidism, here the treatment is different. So here we use anti-thyroid drugs, and there are three main drugs for that: propylthiouracil, carbimazole and methimazole. So if you are taking any of these three medications, that means you are having a hyperthyroidism for which you are treated for. Okay. Only one exception, which can be confusing to people also, is a hyperthyroid patient. When you have a hyperthyroidism, one method of treatment is by giving you a radioactive iodine therapy. And radioactive iodine therapy works very wonderfully in hyperthyroid situation. But the major complication of the RAI therapy is that they land up with the hypothyroidism as a complication. And for this complication, they are later on treated with the levothyroxine. So in such scenario, your diagnosis can be confusing. So initially you had hyperthyroid, you went through RAI therapy, and then you landed into hypothyroid, for which you've been treated by levothyroxine. So only this exception which you need to keep in mind. Besides that, by knowing all these symptoms, blood tests, and what medication you take, you can fairly come to a conclusion whether what kind of thyroid medicine you are taking. Sometimes some people say that I am taking a medicine on empty stomach. What kind of thyroid problem do I have? Well, it is not easy to come to a conclusion based on that, because thyroid problem being very common endocrine problem, many people have this problem. And among thyroid problem, the most common is the hypothyroid. So you see a lot of population who are having hypothyroid medication, and which we usually advise them to take early morning on an empty stomach. And it is this set of people, when they meet in the other general public, they always say thyroid medicine has to be taken on an empty stomach. And sometimes when a person is having hyperthyroid, they also hear the same, and they also take a judgment that okay, I need to take this medicine on empty stomach. And actually that's not true. Though if you take anti-thyroid medicine on empty stomach, it's not going to harm you. But these are not there is no hard and fast rule that you have to take this medicine on empty stomach. And that's the reason why many times people get confused. So if you have taking medicine on empty stomach, and if that medicine is levothyroxine or any medicine which I mentioned to you earlier, that means you are being treated for hypothyroidism. But if you are taking a medicine after meal, or maybe let's say a PTU or carbimazole or methimazole, that means you have a hyperthyroidism. Alright, so I hope that helps for you to come to a conclusion that what kind of thyroid problem do you have. And in spite of listening to this video, if you still feel confused, then don't get confused. Comment box is there. Write your comments in the comment box below. I'm here to help you. I will try to read and answer your question as early as I can. And I hope you like the video. If yes, please click on the like button. And if you are new to this channel, please subscribe to that, so that we get more and more followers, so that encourages me to continue this channel. Because I already have this channel in a Hindi language, where we've got a lot of love from all the viewers like you. And for me to continue making this video in English language, I need your motivation. So please subscribe and do share the video if you feel it might help someone else. Alright, we will meet again with some new good useful information. Till then, take care of yourself. Namaste.